So the first news article that I wanted to share is about shingles. And this is one that made quite a lot of splash a couple of months ago. I think what is interesting about this particular study was that it was done in Wales and Australia, in the sense that they used what's called a natural experiment, just looking at the timing of when people got the vaccine and how in a population, because of the age cutoff date of starting the vaccination program, the authors were able to compare a group of people who really only differed in terms of their birthday by a day or very closely together. So the study that showed the difference between the two groups in terms of the shingles vaccine in Wales and Australia found that people were much less likely to develop dementia among those who were able to get the vaccine compared to those that did not get the vaccine. And this study was only able to be done in countries like Wales and Australia because they had national demographic data that is much easily collected and analyzed compared to the data resources in the United States, and that it found that they were protective against the development of both dementia as well as even possibly new diagnosis of mild cognitive impairment. So in short, Dr. Mia's recommendation is that if you're over the age of 50 and that, or if you're immune compromised, then getting the shingles vaccine could be good for your heart and good for your brain, in addition to protecting against the development of shingles, which can be quite painful. I think this has to do with the inflammation that is caused by viruses like chickenpox or herpes virus, where once you get it, it stays dormant in the neurologic system and can reoccur later in life, which is why it's oftentimes painful and usually in people whose natural immunity wanes as we get older. So a solid recommendation for shingles vaccine based on that.